Okay, so we've been looking at parathyroid glands and the physiology of bones. So let's actually look at the physiology of bones. The bone or the osseous tissue is specialized, rigid connective tissue. Okay, that forms the skeleton. Okay, so it has what we call the intercellular matrix of ground substance. So mainly the bone, you're going to see that it's made up of collagen, and this collagen it's strengthened by the deposition of mineral salts such as calcium phosphates and calcium carbonate. But also you need to know that throughout life, the bone is continuously being renewed by the process of bone formation and bone resorption. This one we call it remodeling. A very important physiological principle. Okay, so what's the function of the same bones? Some of these things you covered in your anatomy classes and histology classes. But it's just important to mention some of the functions: protective functions, mechanical functions, metabolic functions, and hematopoietic functions. Okay, so the bones are also involved in production of red blood cells. This one we call it hematopoietic functions. And then from your anatomy, if you remember, they are classified as long bones, short bones, flat bones, irregular bones, and the sesamoid bones. Okay. Now this diagram shows the various parts of the bone. This is a long bone. It is cylindrical, okay, and it is made up of three portions. There is a diaphysis. This is the mid portion of the bone. And then there is also the epiphysis. This is the wider extremity or the head on either side. So we have the distal epiphysis there and the proximal epiphysis. And then we have the metaphysis. This metaphysis is the portion between the diaphysis and the epiphysis. Okay. And then in terms of composition, the bone is composed of the matrix and then the bone salts, which are called hydroxyapatites. Okay, I'm just running through these things just for revision purposes. And then in terms of the matrix, it is made up of a protein called the collagen fibers. And the collagen fibers forms about 90% of the bone. Okay, and we have ground substances formed by the extracellular fluid like the proteoglycans, the chondroitin sulfate. Okay. Now, in terms of types of cells in the bones, so a bone is actually a living tissue. Okay, it's not really dead because it has cells. And these cells are the osteoblasts, the osteocytes, and the osteoclasts. So the osteoblasts, these are bone cells concerned with formation or with bone formation, as we saw when PTH acted on the osteoblast. So they are involved in bone formation. And then we have the osteocytes or the osteocysts. These are the bone cells concerned with maintenance of bone. What do we mean by maintenance? They help to maintain the bone as a living tissue because of their metabolic activities. What else about maintenance? They help to exchange calcium between the bone and plasma, which is the extracellular fluid. Okay, so the osteocysts, they are involved in maintenance of bone. Okay, and then the last is bone cells. We said these are osteoclasts. The osteoclasts, these are bone cells that are concerned with bone resorption. These are the cells which are activated by PTH and vitamin D. And the osteoclasts, we said these are giant phagocytic multinucleated cells found in the lacuna of the bone matrix. Okay. And then we mentioned that the function of the osteoclasts are responsible for bone resorption during bone remodeling. And they are also involved in synthesis of lysosomal enzymes, secretion of citric acid, lactic acid, which are important in bone resorption. So we said a bone is a tissue, so it grows. Okay. So embryo has a cartilaginous skeleton. The cartilage is composed of large amounts of solid but flexible matrix. So bone are able to grow in length, and we call that ossification. And ossification is defined as the conversion of cartilage into bone. So at birth, there's 50% cartilage and bone. So this cartilage has to be converted into bone. By the age of 2 years, the skeleton consists of 35% cartilage and 65% bone. Okay. So the ossification is carried by the osteoblasts. And then in terms of growing in length, the bones, they have the end called the epiphysis. At the end of each long bone, it is separated by what we call the diaphysis, by a plate of proliferative cartilage, termed the epiphyseal plate. So this is where growth of the lengthening of bones takes place at the epiphyseal plate. Now there is this concept called bone remodeling. What's the definition of bone remodeling? This one is a dynamic, lifelong process in which old bones is resorbed and new bone is formed. So if you are told to describe the bone remodeling process, you have to talk about bone resorption and bone formation. And bone resorption, you talk of osteoclastic activity, and then the bone formation, you talk of osteoblastic activity. Okay. So this is very important. For example, in children, bone remodeling is important for thickening of the bones. Also, bone remodeling is important for normal growth of bones and also shaping of bones in a way that is beneficial to an organism or to a human body. In adults, toughness of bone is maintained, and also mechanical integrity of the skeleton is maintained throughout life. And also bone remodeling is important in blood calcium level maintenance. So it's just important to know that remodeling occurs throughout life. It occurs throughout life. So there should be a balance between bone resorption and bone formation. But in people like those who do a lot of exercise, like the athletes, the soldiers, those whose bones are usually stressed, the bones become heavy and strong. This is because of the stimulation of the osteoblastic activity and mineralization of the bone by repeated physical stress. So apart from physical stress, there's a variety of hormonal substances and growth factors are involved in regulating of bone resorption and bone formation. Okay. So exercise, they help to strengthen the bone, but there are other factors that can weaken the bone, like having a sedentary lifestyle, excessive alcohol, excessive smoking, early menopause. These can affect the strength of the bones. Okay. So let's finally define these applied physiology concepts. There's osteoporosis, rickets, osteomalacia, osteomyelitis. What are they? So that when we look at applied and clinical physiology in the coming years, we should be able to understand. So osteoporosis is the bone disease characterized by loss of the bone matrix and minerals. So the bone becomes porous. That's why it's called osteoporosis. This is a healthy bone. This is a bone with osteoporosis. So there is loss of the bone matrix and minerals. So what can cause this condition? This can be caused due to excessive bone resorption, like in the case of hyperparathyroidism. Osteoporosis is also common in women after the age of 60 years. Okay. So the most commonly affected bones are the vertebra and the hip. Okay. The most common affected bones are the bones of the hip and the vertebra. So there's a loss of bone strength and deterioration of bone tissue. Okay, the other condition is called rickets. From this diagram, you can see that it's a bone disease usually found in children. This is due to inadequate mineralization of bone matrix. It occurs due to deficiency of vitamin D. So there can be deficiency of vitamin D due to insufficiency in the diet or due to inadequate exposure to sunlight. We saw how vitamin D is synthesized from UV light. So that is ricket. So what can you see here? We can see extreme forward curvature of the upper backbone. We can see with convexity backwards. Okay. There is scoliosis, lateral curvature of the spine. There's collapse of the chest walls and many other features of rickets. Okay, which we are going to talk about later on. And then we have this osteomalacia. This is also a bone disease. So sometimes in literature, when we're talking of rickets and osteomalacia, we combine, because rickets in adults, it's called osteomalacia or adult rickets. So osteomalacia occurs because of deficiency of vitamin D. It also occurs due to prolonged damage of the kidney. we know that the kidney is involved in production of 125 dihydrocholecalciferol. What are the features? We have vague pain, tenderness in bones and muscles, myopathy leading to waddling gait, okay? Occasional hypoglycemic tetany. So these are conditions which we are going to describe later on in detail. And then we have osteomyelitis. I've shown you an X-ray here. So this one is an inflammation. Litis, meaning inflammation. It's an inflammation of a bone or bone marrow. It mostly affects the bones of the arms, the legs, the pelvis, and the spine. So here I've shown you are these phalanges or metacarpals, or okay, I've shown you the inflammation area there. So it can be caused by either bacterial infection or the injury. Okay, so osteomyelitis may lead to fever, irritability, severe pain in affected area, redness and tenderness in affected area. Okay, so this is where we end. This is where we end regarding this topic, the parathyroid gland and physiology of bones. Thank you very much.